In this video, we're talking about fever. Now, fever can often be defined as a temperature above 38 degrees Celsius. Now, I guess the question is, when do you need to worry about a fever? And to be honest, it's not about the number. It's about your child as a package. Now, under the age of 3 months, babies don't have the immune system that older kids do, so it's very, very important to seek immediate medical help if your baby under the age of 3 months has a fever above 38 degrees Celsius. Very important. One of the most accurate ways to measure your child's temperature is simply with a digital underarm thermometer. Toddlers often don't like staying still to have their temperature measured. However, lift up their arm. Make sure that the thermometer isn't caught up in their clothing, straight under the arm and down. And you're going to need to hold them still. Give them a nice big bear hug and simply hold them until the thermometer beeps. Over the age of 3 months, it's about looking at your child as a whole. Fever is actually the body's natural response when it's invaded by a virus or a bacteria. The body heats itself up to try and kill the virus or bacteria that's in there. It's actually a good thing. However, it can make us feel miserable. It is a natural defense mechanism. So, by all means, give your child some paracetamol or ibuprofen if they are miserable. We only give it for comfort. It's not about lowering the temperature. It's purely about making them feel better. If you've got a child who is miserable and feeling terrible with a temperature of 38, by all means give them some paracetamol. If you've got a child with a temperature of 39 who's running around and drinking well and is actually reasonably happy, then there's no need to give them the paracetamol or ibuprofen. However, if your child is sleeping and they have a fever, you don't need to wake them up to give that to them. Now, when do you need to be concerned? You need to look at your child as a whole. Now, it doesn't matter what the number is. If they are floppy, lethargic, miserable, they're not drinking properly, they might not have as many wet nappies, and they look unwell, you need to get medical help no matter what that number is. However, even if they have, a higher temperature and they're drinking well, they've got good wet nappies, they're happy in themselves, then you can be less concerned. Now, always trust your instincts. If you are worried about your child because you know them best, always get medical help. But remember, it's not about the number with the temperature, it's about looking at your child as a whole.